Hattiesburg is a community of less than 50,000 people. We're the fourth largest city in the state of Mississippi. There was a community that we found that had in excess of 6,000 people that were not connected to healthcare in any way.
Mississippi ranks very poorly in most health outcomes nationwide. We're working in areas that are impoverished, that are really very rural, and people don't have access to healthcare, they don't have access to health services, and they need it.
This project is called Cities Expanding Health Access for Children and Families. NLC worked closely with 8 cities to build and then implement these city-led outreach and enrollment campaigns to connect their kids and families to Medicaid and CHIP. So the City of Hattiesburg was one of our grantees working on this project, and the city was the lead for the project, but they engaged the University of Southern Mississippi and some other community partners on this work.
Our partnership with the City of Hattiesburg initially started out, I think there was some uncertainty on both parties, with the school and with the city, because we weren't sure how we were going to work together and how that was going to look. And as we began working together and trusting each other more, it grew and it became a partnership that still exists today.
City leaders have a vested interest in seeing their residents healthy, both physically and financially healthy. And we knew that at NLC, working closely with cities on a number of different projects.
We found that there were a lot of barriers that the individuals, families in our community had in accessing health coverage through Medicaid and CHIP. Some of those barriers were things like transportation. The public city buses don't run all the way out to the Medicaid office. Also, people didn't understand eligibility and the application.
Oftentimes, universities go into communities, do research, step back, and then nothing really comes from it. We were able to use the backing of the city government to actually make something happen.
So a lot of what we did was going out into the community, speaking directly to consumers or to our community members.
Would you do me a favor to some of your friends that you know have children that may not have insurance?
Being a part of the City of Hattiesburg, representing that agency, immediately legitimized our efforts into the community. So not only did community members trust us when we went into places like food pantries, WIC centers and health department clinics, the housing projects, those community agencies also immediately opened their doors.
Can you imagine going door to door and a young lady or an older person comes to the door and they have an illness in their family and they don't know what to do or how to do it? And you tell them that you have an opportunity for them to connect to an insurance program for their child, their children, their grandchildren, or for them themselves. I mean, that's giving them hope.
Through the relationships that they've built around this project between the city and the university, they grew that partnership and received the federal Navigator grants, then also the Connecting Kids to Coverage grant to continue their work around Medicaid and CHIP.
There have been approximately 4,000 families who have received coverage through this effort, but we have touched at least or more than 140,000 families and individuals.
And I just know that this relationship is going to continue, whether I'm sitting in this chair or somebody else is sitting in this chair. So I challenge you other cities and I challenge you other mayors, get involved in your community.
We thought going into this that city leaders and city agencies could have a role to play in connecting their kids and families to coverage, but we're really excited to see what it's turned into in communities like Hattiesburg, to see Mayor DuPree get excited about this initiative and put his weight behind it.
It's changing lives.